twin or multiple gestation can be diagnosed as early as 6, 7 or 8 weeks pregnancy. Many patients will have a scan that early because they might have concerns about sickness, potentially about bleeding, or they just want to be reassured about what their due date is. So that first trimester scan is a great time to confirm whether or not this is a singleton or a twin pregnancy. The first tip-off for most patients that they might be pregnant with a twin or multiple gestation is worsened or more exaggerated early pregnancy symptoms. For example, morning sickness, which is often sickness throughout the whole day, is much worse generally or more pronounced in a multiple gestation. For the vast majority of patients who are healthy going into pregnancy, a twin pregnancy will not cause too significant challenges for mom. That being said, being pregnant with a twin or multiple gestation will increase the risk of other complications later in the pregnancy, such as gestational diabetes or high blood pressure. However, most people can be reassured that if they have normal blood pressure going into pregnancy, and if they have good sugar control anyway and good diet, they likely will not get blood pressure problems or diabetes. It is important that patients who have a twin or a multiple gestation have increased supervision during their pregnancy under the care of an obstetrician. This is because of the slightly increased risks of not only high blood pressure and diabetes, but also the risk of preterm birth or other complications with how the babies might be growing. For this reason, patients who are pregnant with twins get ultrasound scans at least every 4 weeks during the pregnancy, and sometimes as common or as frequently as every 2 weeks. That depends on whether this is a monochorionic twin, where both babies share one placenta, or a dichorionic twin, where both babies have their own placenta. So for these reasons, it is important that patients who are pregnant with twins are looked after under the supervision of a consultant obstetrician. The most common complication that patients with twin or multiple gestations encounter is preterm birth. The average gestation age of delivery for a singleton is 40 weeks, but for a twin is 36 weeks, and for a triplet is 33 weeks. Indeed, mothers who are pregnant with twins have about a 1 in 5 chance, a 20% chance of delivering before 34 weeks. And the earlier you deliver, the more likely that neonatal complications may occur. So for this reason, it's very important that patients are monitored and supervised for the potential warning signs of early preterm birth. This might mean regular painful contractions or fluid leaking from the vagina, which might suggest preterm rupture of the membranes.